Welcome to episode 2 of the pin and stretch technique. So today I'm going to focus on neck treatment. So if you're getting some pain through the neck, you can bet your bottom dollar that if you stretch out that fascia, you're going to get some relief. Okay, so we're going to do the pin and stretch technique that I showed you in episode 1. But it's going to be a tiny little bit different, all right? So the same concept applies, where you are pinning down an area of the skin at 50% pressure, and you are also moving away from what you are pinning down. But with the neck, you are going to also drag your fingers along the skin line, okay? So what we're going to do is I'm going to walk you through this together, because ideally, these techniques, you need to allow yourself a good amount of time. It's very hard for me to be producing a video for you in the real-time method that it is actually best for you to apply for yourself. So in other words, allow 5 times the amount of time that I'm showing it to you. Slow it right down and you'll get the most results. Remember, when you feel heat to the area and you can see redness on the skin, you've actually achieved the fascia release that we are aiming for. Okay, so here we go. We're going to work on the lateral side of the neck. Okay, I'm going to show you on my left, which is your right, I think. And what we're going to do, it's actually going to be really quite tender along here, but what we have down here are these muscles called scalenes, and it's also crossed over with a bit of upper trapezius. It's a bit of crossover with SEM as well as your fascia that needs to be released. You're going to get a lot of relief doing this technique. So here we go. So what we want to do is we want to anchor with 2 fingers like this on the top part of our neck, just under our bony structure here, if we can see that here. You'll see my beautiful purple hearing aid. I'm very proud of my hearing aids, by the way. I don't know if you know that, but I am. Coming back to this pin and stretch. So we'll use 2 fingers and we'll anchor just below the bony structure on the side of the neck of your skull, okay? And what we're going to do, I'm going to push down 50% pressure, and at the same time, I'm going to drag my fingers down the side of my neck while I'm bending my head. Now, obviously, you're not going to get all the way down with one whole movement. So take your time and actually bring your ear to shoulder while you are pulling the skin down on this side, okay? Now, you are to go as slow as you possibly can, please. It is most effective if you can do this technique slow. Now, I'm still pushing down 50% pressure. I'm pulling on my skin. I've come back up and I'm going to do it again. And this whole time, this is my 3rd side bend. Okay. And if you need to, bring your head back up and do it 2 to 3 more times. Again, what you are aiming for, I'm not sure if you can actually see it, but there is a little bit of redness here, and that is what we want. We want to feel some heat. We want to feel the blood coming to the area, and that is usually a really good visual clue, an indication that we're on task, okay? So do the side muscles. Another one to release the neck muscles. You would think needs to be happening in the back, but bear with me, a bit of a myotherapy secret is that there are leverage points to help release an area. So when it comes to a lot of neck problems, 70 to 80% of them can be released by releasing the side muscles and our front anterior muscles. So again, the pin and stretch thing can apply if you apply the same technique. So this way, I'm actually going to bring my chin forward like this. You're going to see a lot of flab here, so apologies ahead of time. But you're going to bring your finger forward like this. You're going to get your pads of your fingers at the top of your chin as your chin is forward. Make sure your nails are trimmed. It helps, all right? Okay, so bring your chin forward and anchor the finger pads into your skin at 50% pressure. You may want to use less pressure because it can be quite intense at the front. So as you come forward and you anchor, you bring your chin up, feeling that stretch happening through the skin. It will feel slightly uncomfortable because there are nerves, arteries and veins that are quite prominent in this part of the ear, and there is a little bit of a crossover, not to mention that you're coming forward on your voice box as well, your thyroid, so it can feel very, very different, but I can guarantee you get these guys released. Now, when you get to the collarbone, this is a good point where you can actually anchor and keep coming back. I have gone very slow in that technique, but I want you to go even slower to get the best out of this pin and stretch, particularly for the neck. You want to go very slow as you are doing these techniques. So give it a go. For releasing the neck issues or pain, start with the anterior and lateral as well. All right. Let me know how you go, and I look forward to seeing you in episode 3. Bye.